Hello! Guess who I have today? I'm Dr. Willey. We are so excited to talk today about peptides. We're going to talk about hormone replacement, and we're going to talk about the most controversial topic, which is GLP1s. So we're going to be talking about all of these today. If you have questions, make sure that you are putting them down in the little comment box. I will be trying to check the whole time while Dr. Willey explains everything to us. So let's go ahead. We have some new viewers, I'm sure. So will you kind of give us a little bit of your background?
Sure. Yeah.
Tell us everything.
I'm an osteopathic physician. I trained at the Mayo Clinic back in the 90s, and I've been doing what we now call functional medicine for almost 30 years. Yeah, we call it anti-aging medicine, regenerative medicine, integrative medicine.
Changes.
It changes. Now we call it functional medicine. And that's the type of practitioner I am, using not necessarily always, but integrating Western techniques with alternative techniques, modalities, things like red light, ozone, hyperbaric chambers, exercise under oxygen. So we use modalities. We use a lot of stuff besides just drugs or a surgical referral.
You look at the whole person, right?
The whole person, yeah. I really try. I call it, we look for the whys. Some people like to say we look for the root cause, or we look for the reason behind it. I like the whys. Why is this person showing up in my office with these concerns?
Yeah, real medicine, that's what someone said.
Real medicine, yes.
Right.
There you go.
And you listen. I mean, so if you're new here, I love Dr. Willey. He and I have known each other forever, but he is my own personal functional practitioner. And I just want to say I am so grateful for the time you spend with us, giving everyone some amazing information, because he has no BS. Like, he is going to say exactly how he feels, what he knows, and I just appreciate your time. So
I get in trouble for that a lot, but I'll do it here no matter what.
Listen, we all do. As we get older, it gets worse.
Yes, it does. It does. Yeah, that barrier that slows you down, there's none.
It's fine.
Gone.
It's fine. Okay, so let's just dive straight in. So if you haven't seen our other lives, we've done a lot, and we have covered what a functional practitioner is, how to go find one. We've talked a lot about hormone replacement. We've talked a lot about weight loss. And I know I get a lot of DMs about all of those questions. So make sure you go back and watch our lives as well if you haven't already seen them. So we kind of want to dive into a totally different subject today, because I know, for one, I'm talking a lot about peptides. They've helped me a ton. Mm-hmm. You got me hooked on them. And I know a lot of people have a lot of questions on them because they're the latest, greatest craze, but really they've been around for a very long time. So let's start with this. I do want to touch on hormone replacement first. Sure. Just really, really fast. I get a lot of questions about women that start hormone replacement, and we've already talked in our last live about all the different types of hormone replacement, but they are telling me, a lot of them are like, well, it's just not working for me, or I'm gaining weight on hormone replacement. How long do you give your hormone replacement therapy? How long do you give it before you either, one, go back, because I think communication's key with your doctor, but how long do you kind of wait out the process?
No, great question.
Or do you go off altogether?
No.
Okay.
No.
Okay.
However, it's very layered. You knew that was coming.
I did.
So the first thing you have to optimize, and I have a book I'm releasing now called Background Check.
I will make sure we link that.
And Background Check covers everything behind the scenes. And I use what I call the 5 tenets of health. So your HPA axis, or the effect of stress and cortisol in your body, your hormonal health, toxins in your environment, including toxic relationships. I can put a woman
That's a big one.
That's a huge one.
No, it is.
I can tell you hundreds of stories of putting someone on appropriate hormone replacement didn't do squat. Why? Because they hated their husband.
Yeah. Or they're in a bad toxic friendship, or, there's lots, especially I feel like in that midlife, right?
Yeah. There's so many toxic things. So, and then gut health, and then what we call oxidative stress, or just wear and tear, just time. Because I treat a 55-year-old hormone patient much different than a 35-year-old. Right. So the background has to be set for the hormones you get from your doctor to work.
Okay.
Right. So one of the first things I do when someone comes to me and said, "Doc, I've been on this hormone for 3 weeks, don't feel squat." We review their background, make sure they're eating, they're exercising, sleeping well, relationships are decent, etc., before we just start making adjustments.
Okay.
Now that that's been said, when a woman's or man's given a hormone, the general rule is 90 days.
90 days.
You need 90 days for everything to change, reset, and stuff. Now, the reason that's probably on the far end, because hormone replacement traditionally has been for older women, right? And so you've had, let's say you came to me at 55 and you went through menopause at 49. Now we have 6 years with no hormones in your poor body. I give you hormones. What's going to happen? Freak out.
Yeah. Right.
Things, what's going on here? This must be harming me. No, you're getting used to it again. So that's a general rule.
Okay.
The type of delivery you get is also very important, because a shot is going to work much faster than a cream or a pellet.
Okay.
So we have to be aware what delivery system are you using, and is that delivery system appropriate for your needs? Back to diet and exercise, those just have to be emphasized over and over. If you're not moving and your diet sucks, well, how can you expect the hormones to cure everything?
Right.
They're all connected.
I think sometimes we think that, right?
Oh, yeah.
I know, like, when I was in the thick of everything, I was like, oh, I'm on hormone replacement, everything's solved, nothing else is a problem, where it was actually, like you're saying, multiple layers that needed to be addressed until I started being like, oh, I'm feeling like me again.
Yep.
So I think it's really important what you're saying, right? Like, that 90 days window is really great. But also, like, we got to be looking at our lifestyle. Things change. And that you were the one that told me that, you know, and I thought I was doing everything right, which I know a lot of us on here think we're doing things right, you know?
Yeah, we hope to. And we hope our advice we get is appropriate to do those right things, right?
Yeah.
So that's the big picture look at it. If I was to be more specific for people, most delivery systems, topical creams, pellets, oral, subcutaneous, or sublingual, like troches, all those things, give it at least 3 weeks before you change anything to see what it's going to do. For example, the topical creams and gels take at least 3 weeks to hit steady state. In other words, the hormones build up in your system and then they start to level out. Once you level out, then I want to know how you're doing.
Okay.
Right? That initial phase is a change phase. A couple caveats on that. If after 3 weeks you feel nothing at all, talk to your doctor about slightly increasing your dose. And that's why topical creams and gels are so popular for a lot of us functional medicine docs, is not only the safety profile is incredible, but I teach you how to change your own hormones. And let me give you an example of that. When we live in Southeast Idaho, and back in the fracking days of North Dakota and stuff, I have a lot of patients whose husbands left 2 weeks every month to go to North Dakota to do fracking, to pull oil out of the dirt. And women learned, very intelligent patients, very intelligent.
Yeah, I'm like, hers is good. Okay.
Yeah, they would, when their hubby came home, they go to 8 clicks of hormone. They would triple, quadruple, multiply their hormone intake by 10 while their husband was home. But when hubby left, they went back down to a smaller dose.
So they're
and guess
adjusting.
What? They're adjusting it based on their needs and how they feel. They have to have a better mood when their husband's there. I mean, sexually, performance, all those things. I watch it, I could get in trouble.
I know, I'm like, whoa.
Yeah. My wife's not watching this.
Keep it PG here.
So they would actually adjust it. But guess what? That's what your body does in real life.
That's interesting.
Your body adjusts to your environmental needs.
Okay.
So that's cool. So back to too much or too little. If it's too much hormones, one of the universal first signs in a woman is breast tenderness. Kind of like the best analogy, not having them, but when a woman, or when my lovely bride was pregnant, I remember her running down the stairs like this.
Yeah.
Because they were tender.
Yeah.
So if you catch yourself to start hormone cream and you're running down the stairs like this, back off.
Your dose is too high.
Your dose may be too high.
What about anxiety? I know for me that was something that actually kicked up a little bit more when I started. Is that typical?
That can be typical, and there's a number of reasons for that. The most common one is the progesterone dose isn't high enough.
Okay.
Because progesterone is a precursor to GABA via norepinephrine. GABA is gamma aminobutyric acid is your rest, calm, sleep hormone. I tell people all the time, God gave you about 17 hormones to run away from a saber-tooth tiger, and 1 hormone to go to sleep.
That's crazy.
And that's GABA.
Yeah.
So that would be a progesterone adjustment, most likely.
Which is, I think that's what we did. So.
Yeah, I think that's what
Okay, I had someone just say something. I just thought it would be interesting to have you answer it. She said that she was given estrogen cream to attempt to treat her fatigue, but it made her body break out. So she just quit the cream after a few weeks.
Body breakout like acne, I'm assuming?
I'm assuming. That's what I'm assuming. Maybe she can tell us if she's still on. I don't know.
If the primary problem with that that sentence, if we're reading into it, is she was given one hormone when she should have been given them all.
Yeah, and I know you're really big about that because I know
Balance.
a lot of women, they write me and they're like, my doctor said I only needed estrogen or I only needed testosterone. And I know because we've done a lot of lives and we've talked that you're big on like, no, they all work together.
They all work together.
I think that's important.
It's
a lot of doctors
huge.
don't recognize that.
Mm-hmm. Well, and also Western medicine is designed to treat symptoms.
Okay.
Right? So if you have hot flashes, here's estrogen.
Yeah.
But did we talk about sex life? Did we talk about cognitive health?
Yeah.
Did we talk about your weight?
Yeah.
All those things take a balance of the hormones.
So you would have not ever just given an estrogen cream?
No.
Okay.
No. There's so much more behind it and to it.
Okay, we won't go into all those, but I just thought that was an interesting, we kind of feel like we talk a lot about that. So let's go into this. Let's go into kind of, since we've kind of talked about hormone replacement, let's kind of, you just brought up weight gain. I know that's a lot of people's issues. Big thing right now is GLP1s, GIPs. Mm-hmm. Can you kind of tell us, one, your stance on them?
Mm-hmm.
I already know.
Yeah.
But one, your stance on them, and are they more effective when you combine them with HRT?
Oh, great question. Do you when we kind of talked before we got on live, do you want me to give your wonderful audience more of a little history of peptides?
Please. Yeah, let's do that, and then let's maybe go straight into the GLP. Does that work?
Absolutely, yeah. So peptides are not new. The first peptide was discovered in 1902.
That's crazy.
1902, yeah.
I love hearing this because I get messages every day of like, these are just a fad, these are brand new. No, they're not.
No. In the 50s, a guy whose name I'm losing it starts with a V, discovered oxytocin, which is the love hormone. That's why when mothers breastfeed, oxytocin shoots through the roof, and that causes the bonding with the baby. Mm-hmm. When you have an orgasm, oxytocin shoots up. That's why, not us, but people cuddle after sex. That's oxytocin. So that was found in 1953, I think it was.
Yeah.
In 1965, actually in the late 50s, they came up with a way to make synthetic peptides. It's called solid phase chemistry. And then in 1965, I believe, a Chinese man invented insulin.
Interesting.
Insulin is the first medical peptide, 1965.
Insulin was interesting.
Insulin, yeah. So that being said, now we go forward. There's over 7,000 recognized peptides. There's 500 medical peptides, and the FDA has approved 60 or 65. I can't remember the exact number. FDA approved peptides, 65 at the least.
I love that.
So these are not new things. Now, different ones are new. They're always discovering new ones. And just to give you a little idea, give more background, because I think one thing everyone should do is learn how to ask their doctor questions.
100%.
You have
100%.
to understand, if you're going to take this, don't go into a blind. That is our grandparents' generation, where doctor is God. Right? Do exactly as he or she says. No,
you've got to advocate for yourself. 100%.
Advocate for yourself. Yeah, a peptide is a short chain of amino acids. So if I had a nice sirloin steak here, that's a protein made up of amino acids. The in-between part are peptides. By definition, peptides are 50 amino acids or less.
Okay.
And that's made through a very difficult chemical process called dry chemistry, where we place amino acids in a specific order that then causes a cell signal. So peptides work in the cell membrane, they work in the mitochondria, and they work in the nucleus. Okay. Most all of them have instant effects. Okay,
so let me just, because a lot of us might have got lost there. I might have a little bit. No. I need that medical. I love that. But basic, if you were just to say, really simply, if someone was like, I still don't understand, how could you explain peptides? They're naturally found in the body. Mm-hmm. I always say they're like keys that turn our cells on.
Oh, that's
a
great way to put it.
Okay.
Yeah.
Okay.
Very much so. And that's why, pardon me, there's peptides.
It's the kindergarten teacher in me.
No, yeah, that's excellent. Yeah, I need to be taught to that level many times. So there's peptides for cancer, weight loss, building muscle, burning fat, your immune system.
Libido.
Right? Oh,
sleep.
Yeah, there's just sleep. Mm-hmm. There's just about a peptide for everything.
Okay.
And they're, as a relative comparison to medications, they're very safe.
Very safe.
Because they're just amino acids. Most of them are in and out of your system very quickly. Mm-hmm. And so they're relatively safe. The biggest side effects of almost all peptides are irritation at injection sites or allergies. That's the most common ones we see out there. But to reemphasize, they are not new.
They are not. I appreciate you saying that, because it's funny. I mean, I'm on social media all the time, right? I know you're not, but it's like, it's just funny because it's like the newest, greatest thing, and all of a sudden you just see everyone talking about it. Whereas like they've actually been here for a while.
Yeah.
It's just people aren't talking about it. And honestly, I mean, I started Peptides 2 years ago with you, and I was really kind of nervous to start talking about them because they weren't being talked about. And then when I started being like, oh my gosh, I'm seeing so many good results with them, why would I not talk about them and share that journey? Now a lot of people are starting to talk, so it's like, okay, it's interesting. But okay, so let's do this. Let's go through really quick because I know I get this all the time. Pros and cons. You said the only really like, I guess pros and cons wouldn't be it, but like the safety of it, the risk would be maybe like an injection site.
Injection site
It
irritation.
feels like a little like a bee sting kind of or something.
Or a local rash.
Yeah. But you don't quit if you get a little rash, right?
No,
like you're not
if
allergic
you don't,
to
unless it continues and continues, I may switch.
Okay.
Or we even change the brand of syringes sometimes because some people have metal allergies. Certain syringes cause more irritation than others.
Oh, that's interesting.
There's a lot of different reasons for that, and there are reasons to stop it if you're having reactions to it. But that's probably beyond our little talk today.
Okay, so why is it important with peptides? Because they are all the rage right now. Mm-hmm. Why is it really important to, one, get them from a doctor or some type of telehealth company? Mm-hmm. Why do you want to make sure they're being compounded at the right place?
So great question. So back to that term I used earlier called dry chemistry, very difficult chemistry. And to try to make it simple, we use something called trifluoroacetic acid on both ends of the peptide, and we plant our amino acids in a specific sequence to perform an action. Like BPC 157 is a very popular, well-known one. That's 15 amino acids. Okay. Another one of my all-time favorite one is called KPV, which we use for inflammation, especially inflammatory bowel disease. That's 3 peptides put in chains. So back to getting them from a legitimate source, this trifluoroacetic acid is very carcinogenic. It means it causes cancer, and hepatotoxic. It can destroy your liver. When they say my peptide is 99.9% pure, my eyebrow goes up. I was like, what about that 0.1%?
Yeah. Right.
Is that trifluoroacetic acid? Because if it is, yes, the peptide works, but why would you give yourself something that could cause cancer in the future?
Yeah.
So that's why it's very important to get it from a reputable site.
Yeah. Okay. Another question is, why are they not covered by insurance? Like, because we all want to know, right?
The general
like, why are they expensive? Everybody's like, why are they so expensive? I'm like, well,
I'm going to sound like a conspiracy theorist, but I'm just going to tell you because I'm old and blunt now, right?
Yeah, I mean,
as you mentioned
we
earlier.
warned everyone.
Yeah. The basic premise is if it works, insurance doesn't cover it. There you go. Right. But the system too, we're in a system that's monetary.
Yeah.
So our system's designed to keep you in the system. Why would I give you something to get you out of the system?
Yeah.
And peptides have the power to get a lot of people out of the system.
Yeah.
Away from the chronic
totally
illness.
Agree. Yeah.
I mean, think about some of the biggest kickback in the medical world with these GLP1s and weight loss stuff is, well, when people lose weight, almost everything gets better. Oh, I don't need that cholesterol drug. I don't need my diabetes drug now. Yeah. I don't need my gout drug.
Yeah.
My joints don't hurt anymore.
Yeah.
Oh, now I just got you out of the system. Dang it, I'm not going to make money on you.
Your money. Mm-hmm.
So,
that's why.
Now, the argument from the other side would be, well, they're not FDA approved. They haven't gone through the rigorous research and stuff. And I would say, well, how long does that take? That takes about 18 years for a drug to go through that process.
Okay.
Which sets me off on a totally different conspiracy theory, but we're not going to go there.
No. Okay. Well, I wanted to address that because people are like, it's so expensive. But my answer too is, if I can fix, like you're saying, these health issues now, long term, I get to be 70, 80, I'm going to have a lot better life. Like, I'm going to feel better. I'm not going to be in a hospital spending all the money then, right? Like, hopefully.
Right.
You know, I mean, we don't have a
crystal ball. You can buy a truck, but I don't
suggest it. You don't have a crystal ball, but like, that's what you're trying to do, right? And so I do think it's worth, if you can, you know, like you said, they do a lot.
Yeah.
Okay, so I had a question, and then of course I'm listening to it, and I'm
GLP1?
like, you know what? Let's go into that with weight loss, because so with GLP1s, let's talk about what it is. Mm-hmm. Let's start there, and then I'll ask you.
Okay, so peptides are also, the name peptides also, probably appropriately just due to the semantics, hormones. Okay. They're hormones. weight loss in particular, especially after the age 35, maybe 40 in some people, you cannot undereat your fat and you can't over-exercise your fat.
Right.
And how many people have you talked to that said, I do everything right. I eat right, I eat organic,
it was
I'm
me.
Whole Foods 30, I'm doing a carnivore diet, I'm
in the gym, I'm doing the heavy weights, I'm eating 1 gram of protein per body weight.
You're doing everything right, but if the hormonal background, I use that word a lot, is not where it should be, you're not going to win. You don't win. So GLP-1s are a type of hormone that works on, they're called glucagon-like proteins or peptides. So they work on the whole system of what I call the mother load. The mother load of hormones are all, believe it or not, food related. Insulin, glucagon, leptin, adiponectin, and cortisol.
Okay.
They work at that level. So for weight loss, they work to change your brain's susceptibility to food noise, for example. That's one thing we all deal with when you're trying to lose weight, when you're cutting your calories down, you're exercising hard. The food noise is
so loud.
Horrible. GLP-1s help remove that. It changes transient time. So when food going from stem to stern, you like that stern?
I did. I like that.
Thank you. Is slowed down, which causes more satiety. Yeah. And then on a hormonal basis, getting that glucagon-insulin balance. Glucagon, for example, is the body's best fat burner. Insulin is the best builder. If it's bad insulin, you get fat. If it's good insulin, you get muscles. Yeah. So that balance with these GLP-1s is essential. And a lot of people are, when they're insulin resistant, they're also, without even knowing it, leptin resistant and they're GLP-1 resistant.
Oh, really?
So when you give someone a GLP-1 that needs to lose weight, the people that respond really well are probably GLP-1 deficient.
Interesting.
And the people that don't respond at all are not GLP-1 deficient or resistant. They just get all the side effects. And they tend to be the loudest ones on the internet.
Yes. That's what we were talking about, because I get that all the time. They're like, well, what about all these side effects we're hearing with GLP-1s? I'm like, that's like a diabetic dose.
Yeah, exactly. Dosing's important, timing's important.
Dosing's so important.
And your background. The rest of your health. Are you going to respond to this GLP-1 appropriately? And are you going to be able to maintain your weight loss? Well, if your background's where it should be, hormones in particular, at the top of that list, if those are there, people maintain their weight loss. Because one of the reasons hormone replacement therapy is so beneficial is it protects muscle mass.
Okay.
And muscle mass is the key to longevity, quality of life, all those things. Now, I'm not talking about looking like Arnold Schwarzenegger. I'm talking about maintaining muscle. Because any sort of diet, I don't care what diet it is, any sort of weight loss program should never lose more than 25% of your lean mass. It should be 75% fat mass, at the most 25%.
Okay.
And a lot of people that take GLP-1s, because their hormonal cascade and their background isn't where it should be, they lose 75% muscle mass.
Yes.
Those are the ones that look like this,
and the
have
butt,
an Ozempic butt, all this stuff. They lost their muscle.
Yeah.
And so they may lose weight and feel good now, but they've set themselves up for a lot of problems in the future.
In the future, And if you're on hormone replacement, I read, so I just want to make sure, your GLP-1 with hormone replacement is 30% more effective.
Oh yeah, estrogen in particular. Yeah, I did a talk in Chicago a few years ago, and the title of my talk was the role of sex hormones in weight management. And what people don't realize, and we joke in my world, we joke that you go to college, you gain the freshman 15, go through menopause, you get the menopausal 40.
Yeah, no, for real.
Estrogen is so important for weight stability, especially your shape. You may say, and I hear this all the time, I heard this yesterday, I'm a 52-year-old gal. She says, the scale hasn't changed, but I get all my weight right here. I changed my weight. That's estrogen. That's estrogen. If you were on appropriate estrogen replacement, you would have never gone through that. And that's why in our previous lives like this, I've encouraged people, start hormone replacement sooner than later, and you will avoid that.
Yeah.
But yes, they work so well together.
Yeah, and I was kind of telling my audience, like, when I got on hormone replacement, I was having a lot of issues with weight gain, and it was bothering me, and I was like, no. You were like, let's try a GLP-1. I was like, no, I can do this myself. Remember this? I said this?
Yes, you did.
I can do this myself. I've got this. I was a D1 athlete. I've been in the gym. Like, I can do this. Like,
Yeah.
I came back, didn't I? I was like, this is not working. I am gaining more weight, and I lost muscle.
And you lost muscle.
Doing all those things, which is absolutely crazy.
And that, if I may make a beg for this, get your lean mass to fat mass measured. Never ever start a diet program with GLP-1 without measuring your muscle mass and fat mass.
Yeah.
Whether it's like a bioimpedance or calibers or a DEXA scan or a CT scan, underwater weighing, get your lean mass to fat mass measured. So as your journey with your GLP-1 is going on, you can recheck it. And if lean mass is being sacrificed, you've got to change something.
Yeah.
Because you will pay for it later.
Yeah, 100%.
Yeah.
Okay, we had a lot of questions during that. Oh gosh, hold on, let me go back because they were good, and they were going with what we were saying. Let's see.
I can't believe you can see that.
You know, I can't very well. I'm trying to get close, and I don't want to like accidentally get out of the live by scrolling back, but. Okay, let's see. I know.
That's what I would do. She doesn't let me touch the thing because I would break it.
No, don't touch. Okay, so, this kind of goes with what we're talking about, but these were good questions. Are oral peptides as effective as injections?
It depends on what kind they are. Most peptides cannot survive stomach acid. So as a general rule, other than BPC 157, I would always stick to
Injectables, right?
topical, transdermal, or injectables. Injectable being the most recognized effect. Because it bypasses your gut and your liver. The liver will kill anything that goes in your mouth because that's its job.
Yeah. So, and with BPC 157, right, the pills are more for your gut issues, right? Mm-hmm. Where an injectable would be more like a joint, or can it do?
Great question. It can do, so I use oral BPC-1 just for recovery because I still think I'm 18 when I go to the gym.
Me too.
Right? And without my oral BPC, I am achy, sore and stuff, but I heal much quicker and recover quicker. So it does a lot, but yes, we use it. It is a gut peptide. It's based off the gastric acid protein, and it's 15 amino acids out of that. So it's very powerful for gut health. People with irritable bowel syndrome, inflammatory bowel disease.
Yeah, you put me on that and it helped a lot.
Yeah.
I still take it. Yeah, I love it.
Pretty incredible.
Okay, that was a good question because I know, even with GLP-1s, I think they're coming out with an oral drop. Different things like that, you still would go injectable. I
still would, yeah. Okay. Yeah, for example, there, and we won't use any names, but there is a very popular GLP-1 semaglutide that is an oral form, but it's also a gut destroyer.
Oh, that's
and part of your background is gut health. So you can take this oral GLP-1, but it also beats the crap out of the gut. And when you have gut issues, now you're going to start having immune issues, hormonal issues.
Your gut biome is so important.
It's so important. Okay. And so injectable, you bypass that.
Interesting. Okay, that's a great question that they asked. Okay, I'm guessing they can't patent peptides, so they can't make money from it either.
Back to part of the conspiracy theory I did not get into. So next question.
Don't get him going on that. Okay. Let's see. This was I couldn't really read this very well. So I have a question. I had my hormone blood work drawn. Oh, this might be not what we're talking about, but that's okay. We'll veer for a minute. So I have a question. I had my hormone blood work drawn during my luteal phase. The doctor who read them as a functional chiropractor, she said, according to that phase, all my hormones are correct. A hormone specialist.
Define correct.
There's no correct, is
exactly.
there? That's what bugs me. There's no normal. There's no correct, right?
Well,
Can we just say that out loud?
The normal ranges are here to here. How do you interpret that?
And everyone's different.
Everyone's different.
Normal's different, right?
Really,
it drives me nuts.
Old guys, we use labs to confirm our diagnosis, not to make it.
Yeah.
That is very important. Because if I'm using your numbers to diagnose you, I'm going to miss a lot of stuff.
Yeah. See, I get messages every day that women were dismissed because they were in the normal range, or the best one I've been getting a lot lately. This is totally off topic. Sorry, you guys were kind of veering for a minute, but
you?
I know, right? Just any of you guys surprised. But that they have a period, so they have a normal period. They can't be in perimenopause. I'm like, what?
Mm-hmm.
I got that one twice yesterday. I was like, what?
No.
In the daylights. Please find somebody else.
As a basic rule, and this is what's funny, so I think I've shared this before, but it's a good point to bring up again.
Okay.
Our wonderful OB-GYNs kind of dictate everything that's woman. Mm-hmm. So by definition, menopause is the cessation of menstrual cycles for 12 months. The average age in America is 51. Mm-hmm. They forget the word average in front of the age 51. So if you're not in your 50s, you're not in menopause. Hormones change 15 years earlier. And if you think about it, if you're 34 years old and 6 months old and get pregnant, it's a normal pregnancy. Mm-hmm. If you're 35 years old and 3 months, high-risk pregnancy.
High risk, yeah. Isn't that...
Yeah. So, yeah, you can't just rely on lab values. You can't rely on whether or not you're having a menstrual cycle or not. What are your symptoms? What are you feeling? And how does it relate to things? Yeah. And that's why interpreting labs is not just your numbers are within normal limits. They're, what is this lab compared to this lab compared to this lab? And then the most important, compared to what she's telling me.
That's the big piece, right? That's why that question, I'm like, does it really matter? Like, I mean, I know that you should be doing lab work within a certain time of month or whatever, but that still, like you said, that's not the only indicator.
No.
So go see a new doctor.
Yeah.
That's what I was saying. I get so mad by some of this stuff. It makes me irritated that, like,
you know what we had to do.
That women are.
I'm kind of throwing this out at Lauren, so forgive me. I'm going to be doing a podcast. I'm starting my podcast up again.
You guys, we'll have to. I'll tell you all about that.
Yeah, and we're doing a full episode on, for women in particular, how to talk to your doctor.
I love that.
Because that is so important that you go in knowing how to talk to them. Doctors, men and women, God complexes. We know it all. You don't know anything.
Yeah.
And so how can you express your concerns to this highly educated, trained professional
without them blowing you off?
Without them blowing you off.
Yeah. Because I think that's what happens too, is like, I know a lot of women are like, okay, what exactly are you doing to me? And I'm like, listen, we're all different. So for me to say, like, this is what I'm doing and this is what you should go do, or like whatever, no, like you really need to go in with the right questions, the right information. And yeah, you could say like, oh, like my friend or someone I watched is doing this, this, and this. Would that be right for me, right? That might be a question. And kind of lead some conversation. But so many women are not having doctors, providers listen to them, and it's
no, and you know, that's one of the coolest things about the majority of functional medicine practitioners is they purposely make their appointments to listen, spend time with you. Yeah,
and I think that's what we need at this time in our lives.
That's what you need. Yeah,
we need someone to listen.
Yeah.
Okay. Really quick, someone just asked, and I lost it. Oh, the peptide for IBS and recovery was BPC 157.
And KPV, or that combo is probably my favorite for IBS.
What about BPC 157 and
TB500?
Yeah.
TB500 is a thymic peptide, so it modulates the immune system. Those two together are incredible healing peptides. Okay. Those are peptides like if I had a sore shoulder, if I inject subcutaneous BPC 157 with TB500 around my shoulder, I'm going to heal my shoulder. So we use a lot of them pre and post surgical. So their prehab's good, their rehab's good. Great recovery / injury healing peptide.
What's the best peptide or peptides for overall metabolic health, maintaining and building muscle, and collagen and elastin production?
How long do we got?
I don't know. How long are you guys going to hang out with us?
Oh my goodness. There's a lot more than people realize. The most popular one is called GHKCU. It's a copper peptide. If you combine GHKCU with TB500 and BPC 157, incredible effects on the skin and cosmetics. Yeah, incredible.
What about, so I haven't even told you this, I'm doing tesamorelin and ipamorelin.
Oh.
And I've seen huge with that one.
Awesome stuff.
Do you like that one?
Oh, awesome. Tesamorelin or tesamorelin, however you want to say it.
I'm saying
which side of the Mississippi you're on, right? Rassle, whatever. Wash, that's my favorite. Wash. I'm going to wash my clothes. And people around here go, you're what? It's washed in our side of the world. Semantics there. What was the question? I got sidetracked.
Do you like that peptide?
Oh, okay. Yes. Tesamorelin is actually FDA approved for intra-abdominal obesity in HIV patients. Really? So that is an FDA approved. It increases. It's called a growth hormone releasing peptide, a GHRP. So it increases growth hormone, which builds muscle, burns fat, improves your cognition, helps you heal, recover better. Ipamorelin, or tesamorelin, forgive me, is a GHRH, growth hormone releasing hexapeptide. Ipamorelin is a GHRP, growth hormone releasing peptide. Okay. So its half-life is much longer, about 4 hours compared to tesamorelin, which is about 20 minutes. Okay. So the combination of the two really do wonders for your growth hormone.
Yeah. And sleep too.
Oh,
I feel like I'm sleeping so well.
Absolutely. It's incredible for sleep.
Okay. All right. We got kind of off track because I started having you answer questions. Oh, everybody wants to work with you. We'll get to that. We will get to that. I promise. Okay. Can you write that in the comments? The BPC 157. If you go to my peptide bubble on my page, you can actually go and find it there. There's like information on what that is. Can you please say the recommended peptide? You guys, I will make sure that after this, I write down all of this, and then I'll have you comment a word, and I'll send this all to you. So don't worry, we will.
And she sends a lot of those questions to me, and I can help her.
Yeah.
Which I'm happy to do.
Will this be, yes. The live will be available for playback. Okay, let's do this. We're getting longer, so let's see if there's any other ones. This is a really good question. If I go on a peptide, let's take GLP1 off the table for this question. But if I go on a peptide, do I have to stay on it lifelong, or do I cycle, get off, and go back on, or do I cycle, get off, and never go back on?
That is a great question, and that is a very personalized answer, depending on what we're treating, what we're using it for. As a general rule, some of the anti-aging peptides, like epithelion, is a cyclic peptide. Some of the immune peptides are cyclic too, like TA1 and TB500 even. Some, I encourage some people, especially older, like your growth hormone starts to go down when you're 25. Right? But it's an interesting fact that your pituitary gland, which releases growth hormone, has the same amount of growth hormone when you're 90 as it did when you were 18. It's just not accessible.
Interesting.
And so some, like the growth hormone releasing hexapeptides, for a lot of people, once you start them, stay on it. Just stay on it, because growth hormone does wonderful stuff. We all remember being 18.
So you don't have to take a time off of that?
Not really. There's no real data that benefits that. The worry is something called tachyphylaxis. And the best way to find tachyphylaxis is the first time an alcoholic had a beer, got a great buzz. Now it takes a fifth of vodka for the same effect.
Oh, okay.
So the fear is, if I stay on this, it's going to stop working. There's no data to prove that that's true.
There's not. Oh, that's interesting. No. Okay.
So one of the biggest reasons for my clients cycling peptides, money.
That's really that's the biggest thing, right? Like the affordability of it.
Yeah.
I mean, it's a price point.
It's a high price point, unfortunately.
Especially if you're getting good peptides.
Yeah, if you're getting the stuff.
Someone sent me they were gonna get a lot of peptides for like $90. I was like, I don't think that's a good.
That's probably not
Just be careful. Like that's all I'm gonna say about that.
Yeah. That's like me fixing your car.
I know. I'm like,
you don't want me near your car.
I'd be a little weary of something like that. So do your research. But okay, so that's interesting. So you can stay on it long term.
Yeah, a lot of them can.
So GLP-1s. We'll go into that because I do get that question a lot. What if someone's like, I need to lose? We're just going to use a basic number, 20 pounds. I'm going to microdose a GLP-1. I get to my results. Do I stay on that, or can I get off? And if I get off, will I gain the weight?
Oh, great question. Back to your background.
Okay.
What's the rest of you look like? Because my patients, I'll brag, never gain their weight back. They don't. I cannot name a single, and I've been using GLP-1s since liraglutide was available in 2008, 9, right? For weight loss and bodybuilding. I did a bodybuilding show in 2007 and used liraglutide as one of my pre-contest peptides.
Yeah.
So again, they're not new.
They're not new.
So that depends on the person. What's their background? Are they on hormone replacement therapies? Are gut good? Are they controlling stress well? If all those things are true, you probably can get off and stay off of it. But we have a lot of maintenance dosing schedules. I have clients that do microdose of tirzepatide once a quarter. So they're doing 4 shots a year to maintain weight. Yeah. And we use that a lot because the GLP-1s were originally designed to treat cognitive disorders in the 90s. And so I use them for cognitive dysfunction as much as I do for weight loss, to be honest. And those we can do low doses spread out long term. So finding the right maintenance schedule is really personal and person dependent. I can't just give you a recommendation because I don't know the rest of you.
Okay. No, I love that. That was helpful. Even for me, I'm thinking. I need to talk to you again. Okay, best peptide for anxiety. I think I know because you gave it to me and I loved it.
Peptide for anxiety? Probably my favorite, Schlank or C-Max.
You didn't give me that one. You gave me DHHB.
Yeah, we did DHB, which is Mongolia bark on steroids.
I loved
it. DHB is incredible.
I still take it. I love it. It's amazing.
And you can buy that over the counter.
Yeah, that one's not injectable. It's
No, that's an oral.
Okay. Can you think of anything else that I've missed?
No, not from our pre-live talk. I think you covered everything.
That's a good.
Yeah.
I hope that was
That's a lot of information too.
Yeah, and I hope that was a really good precursor to all the questions you guys have been sending me. Let's answer this. Where can they find you? Have you got your telehealth?
So yes, so our last live, we were setting up a virtual medicine thing, and unfortunately, all the state regulations, because, so I'll give people, I don't know why I'm going to tell you this story, but I'm going to. In COVID times, virtual medicine, telemedicine was very easy because we weren't allowed to see each other face to face. All those laws ran out. So now we're back to state-dependent licenses. So someone like me has to have a license in your state for me to consult you. So we're going through a service that will get me licensed in almost all the 50 states.
That's amazing.
And once that occurs, boom, we can do pretty much everything. We still encourage people, if you do telemedicine or something, it's always in your best interest to go meet the person face to face. Let them do diagnostics on you. Let them do like your body comp, do heart rate recovery, do muscle testing, do all these things so that practitioner can really dial you in. So it's always best if you can visit someone face to face for the first visit. And then according to most states' Board of Pharmacy laws, you're good for 1 year for prescriptions after that. No matter if I didn't have a license in North Dakota, I used that state earlier, so I use it again. But I saw you face to face, I can still write prescriptions for you for a year in North Dakota. So that's always your best bet. And I highly encourage that because a good physician-patient relationship is personal, right? And I'm sorry, but phones, social media and stuff, not personal to you social media people, is not personal. You need to get face-to-face with this person if you're going to trust them with your health.
Someone said, what if I can fly to Idaho? Well, then you can come see him.
Oh, then that's easy. If you're
I'll
here,
go out to lunch. No, just kidding.
Yeah, exactly.
You can come see him. And I'll put all the information of how to come find your clinic too.
Absolutely. And then, let me offer this too, because we were hoping to have this ready by now. If you wonderful people email my patient care coordinator, Lindsay, at Lindsay.
Here, I'll write that down. You don't even have to say it.
Yeah,
You'll
she'll
just tell
send
me
it to you. And say you have an interest either visiting with me or hearing more. Once that's set up, she will email you back and tell you specifics.
That would be awesome.
And a couple of my newer books, like Background Check, I have a shorter 40, 60-page version that we're going to email people.
Okay.
And so if you email Lindsay saying you're interested in that, you will get a PDF of that, and now you'll understand what you have to do for your background. So everything you do, pardon me, peptide-wise, hormone-wise stuff is going to work.
Perfect. Okay. And I'll make sure, you guys, that I get all of this. Give me a minute, because I'm going to have to go home and type this up, and I'll get it sent out, all his information. As soon as you're up and running for telemed,
And that's why we
know.
decided to collect some of your wonderful people's email. Because if we have that, and once we're that set up, Lindsay is very efficient. She will get you an email describing the process.
Yeah. He's in Pocatello, so we are in Pocatello. So
southeast corner of Idaho, about 2.5 hours
from Utah,
north of Salt Lake City.
Yeah, she's in Coeur d'Alene, so you got to drive. Yeah. You got a little bit of a drive, but not too far.
But it's a pretty drive.
It is a pretty.
Just do it quick. Before it snows.
Lisa Moser says, "Tell Warren I say hi."
Oh no, I love that woman. She's amazing. She is an incredible author, public speaker. Big kudos to that girl.
I love it. Okay. Well, thank you so much.
Well,
You're always the best. And if you guys have questions, like always, drop them down. Let's have you comment. What word should they comment to get all this information? Do you like how I put you on the spot?
Yeah, I did.
Should we do what if we do help 1 2 3?
Yeah, there you go.
We could do that.
Simple.
Comment help 1 2 3. I will get back to you. It's not going to send you anything right away like normal, but I will get back to you as soon as I get it typed up. I will get it all sent out to you. So help 1 2 3. We'll send you all the information, everything we talked about today, and where to find this guy. And we will be doing another live.
Yeah, let's do another one.
We'll do another one. So.
And if you guys, if I may again volunteer Lauren for this. If you have specific topics you want to talk about that we want to do a deep dive in, we cannot be so scatterbrained like both of us are. That's why we love each other so much.
Yeah.
We can get a deep dive going on some of these topics so you really understand them.
Yeah. And make sure you're not commenting help 1 2 3 right now, because I won't see it. So wait till I post it. I'm going to post this on my main page. Sorry guys, you guys are all like help 1 2 3. But wait till I post it and I'll then be able to see it. But right now I won't be able to see it once I turn this off. So anyways, we appreciate you guys hanging out.
Yeah, thank you.
Thank you,
my dear.
We'll see you guys soon. Bye guys.